The healing process takes time. During the presentation, I said an example. If you are Cristiano Ronaldo, if you are super rich, you can pay as much as you want, but if you want to make a baby, you have to wait 9 months.
Even for Cristiano Ronaldo, 9 months.
Good.
Good afternoon from Bucharest. We are at CCAR Congress in Romania. My name is Rares, and with me is Dr. Bogdan Kulik.
Hello.
And it's a huge honor. He is one of the mentors of Perio. Without any further ado, Professor Dr. Giulio Rasperini.
Thank you.
Nice to have you here.
Thank you.
So it's pretty cool that I attended your lecture today because I have my Perio exam in 2 weeks. So I'm going to go and just nail it. Thank you for your lecture. It was very interesting to see your approach of Perio. But could you summarize for those who have not seen your lecture, like what are some highlights of your vision in periodontology?
I mean, people take courses, and to attract people to attend to your courses, you always put the word surgery, advanced, aesthetics. Actually, periodontology is a disease, is an infective disease. A great part of the time and the effort should be invested into to teach to the patient and to motivate the patient to behave, to clean properly, to quit smoking, for example. We need to remove the factors that create the disease, I mean, like the plaque, and some cofactors like smoking or general disease like diabetes, for example. We should ask to the patient to go to the physicians and to put under control this disease. Then, after the infection has been controlled with non-surgical therapy, the first approach should be the minimally invasive approach, because there are surgical techniques that with a very small incision allowed you to have a very stable wound. So if you have a very stable wound, it's much easier and predictable and less painful for the patient, and the risk factors are a lot reduced. And so this is the first choice in the clinical field. Then when this is not possible, and we need also to increase the soft tissue, we need to combine like a mucogingival approach, like advancing the flap corneally, together with periodontal regeneration. This is a little bit more complicated, but we have seen the techniques that's been described in details.
I enjoy very much your approach, that not jumping directly to surgery. So what do you think patient motivation, patient oral hygiene and initial therapy, it's like more important than surgery or as important?
Yeah, it's the key, because if you say, okay, my patient, they will never clean properly. They will never clean properly even if you remove the teeth and place implants. And this is a risk factor for implants as well. My patient doesn't quit smoking. Smoking is a risk factor for implants as well. So this is, if you want to be a good dentist, you have to teach to the patients to quit smoking. And the first thing is to quit smoking yourself. Because if you're a dentist and you smoke, how can you tell to your patient to quit smoking? So I think this is really the key. I mean, to not only you, all your staff, all your team should be very focused on this. As you have healthy patients, then you will see the best treatment. Can be implants. Often it's implant therapy, but in clean patients.
There are a lot of periodontal disease we can see today in our patients. What recommendation can you make for a patient with periodontal disease and who requires implants? Can we place the implants in a patient with periodontal disease?
Absolutely not.
We have to do something?
No, absolutely not. The patients should understand. Because I understand, patients, they want everything quick and cheap and well done, okay? This is impossible. First of all, we need to have no periodontal disease anymore in the mouth, saving the highest number of teeth possible, because the patient should understand that the natural teeth has a much bigger value than any implant. Even the best implant has not the same value as a natural vital tooth. So what I would recommend is to explain these things to the patient and to wait for the healing process. The healing process takes time. During the presentation, I said an example. If you are Cristiano Ronaldo, if you are super rich, you can pay as much as you want, but if you want to make a baby, you have to wait 9 months.
Even for Cristiano Ronaldo, 9 months. Good to know.
If you want to have healthy tissue, you need to have a very good hygienist that provides a very good non-surgical therapy. When the non-surgical therapy is be done and the patient knows how to clean, now you have to wait. Like when we go to the gym, it's not that after a week you have a perfect body. You need time. And then after time, and if you are consistent in this, you will see the results.
It's amazing. But I know you are very close to students and youngers. I think you teach to Milano.
I teach at the University of Milan. Yes, I'm associate professor there, and I'm also associate professor at the University of Michigan, United States.
So, okay, I wanted first to ask you about, but I'm going to ask you something now different. Do you see any difference in mentality, at least, between students in Milano and students in America? Do you think they approach perio differently? Or do you think Europeans have a different approach to perio than the United States? Did you feel something like this?
I think the only difference is the plan that they have for the future. In the United States, for example, schools are very expensive, but then when you finish, you start to work, it's still a work when you really are very well paid. In Italy, in this moment, our students, when they graduate, they cannot open an office because we are already too many dentists. And so they will work as a co-worker in some dental office. They will not make a lot of money, and they will have to work hard. Here I see a lot of hope, and I'm very happy. I see a lot of people very focused, very go into details, and very interested with a lot of passion. And this is the key. I mean, if you have passion and you put your time and effort, you will get the results.
You have spoken some very good, let's say, tips and tricks in the presentations. You have mentioned, let's say, the difference of the bone and the tissue, when to extract the tooth, when to not. So this leads me to an idea. So can you summarize in, let's say, 3 or let's say 5 points, what are some key mistakes that you can see in periodontology nowadays, and people should change their perspective into what you showed us today in the lecture room?
Okay, if the only problem of the tooth and the site is the periodontal disease, you can almost always save the tooth. Even I showed cases also with the lesion that goes apical to the apex of the tooth. But if I remove more teeth because of endo combined lesion or combined with furcation involvement with a very severe defect and mobility, all together will make very difficult to save the tooth. Very often I remove teeth because there was a previous restoration and maybe the crown failed and the post failed, and now you look into the endo part and there is soft tissue inside. You have to remove, then becomes too weak and you cannot restore in a predictable way to support a prosthetic restoration. So these are the route I extract mostly. Not for periodontal reason. You can almost always regenerate.
But the tendency today is to extract everything and place implants. I saw a lot of presentations where teeth that, in my opinion, can be saved, extracted just in order to put implants.
Yeah, tell to the speakers. Raise your hand and say, look, why you didn't save this teeth? It is not ethical. It's simply not ethical. Because the patient believes that it's an investment forever. I say, I paid this money, it's going to be forever. Implants are not forever. Teeth, if you keep clean, are forever. But if you keep clean, otherwise, not only the implants is not forever, also the crown restorations that we put on top are not forever as well. So maybe the implants will survive after 20 years, but the teeth on the crown you will need to make again. So you start a process, and the bone that you have lost, because every time you remove teeth, you lose bone. So the bone you have lost will never come back. And every time you will have less bone, until you don't have any. And in some cases, you would have not anymore the possibility to place implants. So in 2018, it's much better and smarter to be honest and ethics and tell to the patient the truth that his tooth is much better than any implants. In case he lose the teeth, we will place implants. And in case you place an implant, you should put we have sponsored with very good implant systems. We should use a good implants also.
Going back to keep it clean, you told us during the presentation that maybe the most busiest person in your practice is your dental hygienist.
Yeah. Yeah, she's very successful because very often I receive patients referred from dentist. And the dentist says, we did already the hygiene. And I probe and I can feel the calculus inside. And the worst cases are the one where the dentist says, I did hygiene by myself. This is the worst cases. It's much better to have a very good hygienist, to train, to grow together as a team. I mean, periodontology is a teamwork. If you notice, I use in many cases orthodontics as well, or restorative dentistry as well. I mean, we need to work but as a team together, not fighting, but giving the best service to the patient and to do for him what he needs, not more than what he needs. Mm-hmm. Extracted and placed implant is a shortcut, is a making money machine, but long terms will come back like a boomerang with a lot of problems, perimplantitis and things difficult to solve.
I'm thinking nowadays, because me and my colleagues, students, see you on stage and we want to be like you one day, to be able to do this.
You're already better than me.
No. But do you remember your early days in perio surgery? How was it? What mistakes that you did help you come where you are now?
What did you change during the time?
Yeah, honestly, I have to think about mistakes. I invested on good courses, I have to say. I was never looking for a cheap course. I was looking for the best.
Okay.
First local, like in Italy, then international, and then moving. And then trying not remain forever students. I mean, each of us is a forever student, but also you begin to show what you did. And I tell you, I put a lot of energy, power, money in this profession and time. I have no hobbies. I can play golf, but I don't do. I have no time. I have friends with the boat, but I cannot go there because in meetings, on weekend I'm in meetings.
Do you go sailing with the boats?
Yeah, I like to do that, but I don't have time to do. I play guitar. I have no time to do. Theoretically, I have a lot of hobbies, but
speaking about time. Okay, so you made me curious. So, how does a day of your life looks like back in Italy?
Every Monday I'm in my office.
Every Monday in your office.
Every Tuesday I'm at the university.
Okay.
Full day, and every Wednesday I'm in my office again.
Okay.
Thursday depends. Sometimes I have lecture at the university. Sometimes I'm in my office. Sometimes I'm already traveling. Like for example, this Thursday. What I did, I worked in my office since early in the morning till 1. Okay. Then I took the flight to come to Bucharest. And then the weekend, I'm always giving courses in my office with my iPerio team. And in Piacenza, it's 50 kilometers south of Milano. Or traveling like I'm doing today.
What is this team that you have, iPerio? What's the story about it? What do you do with them?
iPerio is a group of friends that believe in periodontistry, believe in education, in research, and so we established this group. And we provide courses on hygiene for dental hygienists, for team. We also personalize that. We give a master course. We give lectures in any language with translators. So small groups. We like to have small groups, maximum 12.
So people that are watching us right now can join your lessons in Milano, in Piacenza.
Of course.
Okay, so guys, iPerio, go search on YouTube, on internet, and you're gonna find
always with live surgery, always with hands-on, and a lot of time into details. And I always cook, usually for the team.
And the final question, I noticed during your lecture that you do also a lot of research. Do you think the research and going back to the basis in order to treat this periodontal disease, as you said, is a disease,
Yeah.
is actually the key point.
I mean, the reason why I do research is because I read the literature, and sometimes you have a question, and you can't find the answer. And so you need to do the research because there is no answer, so you need to give an answer to yourself, and then you like to share with the others. And this is the way you grow, and the reason why you write papers. And for me, it's the key. I mean, if you need to be updated to the research. Now it's so easy. You go on PubMed, you find all the papers.
Is it any study that you made that it's most close to your heart? Or do you think that influenced the most, let's say, perio or dentistry?
What you like most are like the surgical techniques I think one of the best I ever did is we were the first team together with the University of Michigan to develop a 3D printed scaffold that we placed in the human being. And this was published on journal Dental Research. That has a very high impact
Top
factor.
level, yes.
Yeah, very high impact factor.
4 point something.
And I was the first author of this paper. And it's only a case report, but first time done in humans. So it's very good. We had a complication that we, of course, share.
So as a wrap up, we're approaching the end of the interview. I want to go back because we spoke about clinical, but it's interesting to find and to know the human behind a dentist. So how did you start? I mean, how did you know that you want to be a dentist?
Oh, I decided when I was 8 years old, what I remember, I was telling with my classmate, Dario, his name, that we will be dentists. And we are dentists, both of us.
Dario also is a dentist.
Dario also is a dentist, an orthodontist now, in my own town. And we were classmates in the elementary, and we were talking like kids, what you will do. We will say dentist. I didn't even like my dentist at the time, but I thought I liked to work with my hands, and then growing, I keep going, and then I became. Now my daughter is in the dental school as well.
In Milano?
No, in Madrid.
She's
in Madrid. Studying in University Europea.
Okay, so the final, let's say final question. 2 or 3 tips and tips for students to approach to be a better periodontologist.
Go step by step, give the time to the tissue to heal, and do the treatment in your patients that you would do for your own mouth. And I think in this way, you will treat your patient wisely.
Thank you so much for your time, sir.
Thank you.
Thank you very much.
Thank you. Thank you.